We are back with the much anticipated sequel of our pre-reg journey. I don't even know if it was anticipated, but we are here.
Yeah, we're here.
We thought it would be nice to give a life update since we dropped off the face of YouTube, but you know, it was busy.
It was
Things
so
have been
busy.
Today we just wanted to speak about our pre-reg. We are pharmacists now.
Yeah.
Last year, or no, we graduated in 2021.
Oh yeah.
We did our pre-reg last year. We did the June exam. We had our graduation ceremony last year. That's what I meant.
Yeah.
So yeah, so 4 years, 5 years come to an end, and we're now practicing as pharmacists.
We're here. How do we feel about that?
It went too quick, didn't it?
First of all, it went so quickly.
Yeah.
I feel like we just rushed into it kind of thing.
Yeah.
Like some people, like, you know, they've taken their time, they've taken like a gap year.
I feel like the jump from after pre-reg, it's like, I feel like it was like a cut-off, very anticlimactic, like, here you go, here's your registration number, that's it, you're a pharmacist.
And that's it, done.
And then next day you're in the working world as a pharmacist, so you go from being a student to a pharmacist next day.
Yeah.
Apparently you're competent enough to save lives.
Apparently.
We just want to give you like a day-to-day run through, because I did mine in community, she did hers in hospital, as you may or may not already know from the last video. If you are a viewer from the last video,
go check out the last video, by the way, if you haven't seen it, because it will make a lot more sense. So the first point we just wanted to talk about is where we did our pre-reg, like little differences, what was the pay like, all of that juicy stuff. So for me, I did mine in the nearest hospital to my house. It was in London, and I commuted to work through bus every day. It wasn't too bad, I guess. It was a London hospital salary, but like outside London, so I think it was 28k, 28.6k, something like that, which was on the higher end of what you would see being offered for pre-regs on Oriel. Yeah. That's it.
So all of hospital was like a standard as well, isn't it?
Yeah.
But whereas community kind of varied a lot, which went into like one of the reasons why I chose my place as well. Location wise, I was quite close to home as well. I was in Lewisham, and then journey for me as well was just bus, so that was okay. It was about a 1 hour journey, because Lewisham to where I am, busy roads and stuff, kind of pushed it to that 1 hour end. I chose a place where, regarding the pay, it was kind of on the upper end of all the other community pharmacies. My one was independent as well, so there was that. That's why the wages were a bit higher. But I think all in all, if you're like booking somewhere like Boots, which is also like a standard pay, like 18k compared to like an independent that I was at the end of the day you get taxed, so it works out the same.
Yeah, that's
so tax, national insurance, pension. I mean, it will go to me in the future, but like still pension. All that kind of deductions, kind of, you know, it wasn't that great, but you know, it was better than just going for Boots, you know. So.
And the next point is sort of explaining our day-to-day job. What was it like? What experiences did we get? What training did we get? All of these things we're about to get into.
Oh yeah.
So I guess the first thing we should talk about is the hours. I did, mine was 9 to 5:30. That was the pharmacy opening times. And then it was when I started, because it changed like halfway. When I started, it was every 1 in 4 weekends or 1 in 5 weekends. And then on Saturday, it was 10 to 3, I think. And then Sundays, it was 11 to 2:30. Or it was 11 to 1 or something. It was something like that. And then halfway through the year, they switched it to every 1 in 7 weekends, I believe it was. And then it'll be 9:30 to 5:30 on both Saturdays and Sunday, because they wanted to extend the sort of pharmacy hours. Weekend working was obviously more quiet than the weekday, but again, there's less staff working the weekend, so you still have kind of a lot of work to do. But yeah, that's sort of the timings of the day.
For me, I don't think there was any kind of like rest period. It was like my pharmacy was in the town centre, so it was always busy. My working week was Tuesday to Saturday. I worked 9 to 6 on the weekdays, and on Saturday it was 9 to 5:30. And let me just say, that extra 30 minutes made a difference to my day. So, you know, in terms of like holidays, we only got like 20 days annual leave plus the bank holidays. So I think that was 8 bank holidays.
I think it was like 25 days holiday.
You got more than me, that's what I remember.
I can't remember if that included bank holidays or not, but...
No, I think the bank holidays were separate.
Was it separate? Listen, she might know my contract more than me.
Yeah, I was jealous of her. Every other day I heard that she was like at home or somewhere else, and I was just like, that's not me.
But the annoying thing is that you have to take a certain amount of that before the, like, because you know how the new year begins for us in April, so I had to take some in March. I think we could only carry over 5 days into the new year, and obviously everyone was going to do that because we all want to take days off to revise for the exam. I had some left, so I was literally taking all this holiday in March, and like I also had like COVID around that time, so that was, well, I can't really call it a week off because I was ill, but still. And then some placements I got to work from home, and there was just a lot of leeway from you guys. So I don't know why the month of March I was off quite a bit, and then I even took my driving test in March as well. Yeah. I think we both saved up. Well, she saved up all her holidays.
Every single one, because it mattered for me.
Yeah.
I knew, especially because in community, like the timetable was hectic. I remember getting home, I was too tired. And I feel like depression hit as well, where the tiredness got to me. And by the time I got home, I'd eat and then sleep. And then it's like...
repeat.
I can't like stay up too late because then I have to start leaving the house early, get to work, that kind of thing. So for me, saving up those days to use at the end was the best judgment, really. My tutor did not agree.
I couldn't even do that anyway, so...
Yeah, it's true. Whereas for me, I think the reason why the whole April turnover thing didn't matter was because I was only there for 1 year, so they thought, you know, like, we'll just carry on.
Yeah, and it's a smaller team as well, so I guess they're more like, flexible. But for me, like, because we had quite a lot of dedicated study time, so Monday afternoons, we had like presentations that we'll give to each other. So we had that entire, like, I think it was from 2 or 3 technically, but most of the time we would let it go at lunch, which would be 1 o'clock. So we had Monday afternoons off practically basically the entire year. And then we'd have like random study days with LAYS, which is London and South East England, HEE or something. Like all the hospitals, we'd have like, together we'll have study days, and even within the hospital sometimes we'd also have study days. So we had all these like random, and once a month, we'd have an entire study day just for studying. So that would be a day off.
Our one was like an external body, so once every month. My community also, the reason why I chose it was because a lot of community pharmacies, they actually are signed up to like an external course, but they paid for me to do like the Pro Pharmacist course, which was, let me tell you, that was the best thing ever. I don't know about the other ones. I have a few experiences here and there of other like resources and stuff from like Greenlight and pre-read shortcuts, but Pro Pharmacist was godsend.
Wait, what was the slides we were using? Oh, it was Pharm Educate, wasn't it?
Pharm Educate, we went on to that later, but like Pro Pharmacist was great, and it was like once a month as well, once a month sessions. Again, we were in like COVID teaching as well, so I think the 1 or 2 days was in person, the rest was online. From home, so I got to be at home for those days. I didn't have to go into work, but those counted as working days. Yeah,
I will sign up for Pro Pharmacist, but under uni. So they only arranged for us to have a few sessions towards the end of the year.
Yeah.
So that's my experience with them, and they were actually quite good. Like
they were really great.
They went through it a lot, and they're like calculations and all the clinical stuff. Like you learn a lot. So yeah, I found it quite useful on top of like all the other stuff that I've already done. It was like, it was a nice add-on. It was a nice tie the ribbon kind of thing and make it look cute. In terms of what our day-to-day job looked like, so for me, the entire year was kind of split up into rotations. So let me give you an overall. So in the mornings, 9 to 1 mostly, I'll be on the wards. And then in the afternoon, that was split up across the year, but there will be dispensary. 6 weeks we had we were doing a project, and it was doing like an inpatient survey. And to be honest, I wasn't doing a lot for that survey, especially when I did mine. It was right at the beginning of the year, and we all contributed all the. Oh, I even forgot to say the people at my hospital. There was 10 of us together, but it was split across 2 hospitals. So at mine it was 5, and at the other hospital it was 6. So all of us sort of shared that project, and it was a survey because that was one of the learning outcomes, I think, to do like an audit or a survey or something like that. So I did mine right at the beginning of the year, and it was sort of just doing like a beginning draft of the survey and do like a pilot survey. But it actually didn't take that much time. So at the beginning of the year, I wasn't even like focusing on this pharmacy thing. So it came at such a good time for me because like we could do our work and kind of just chill and go home. I'm not gonna lie, there's so much like, well, I don't know about other hospitals, but my hospital and the people that I was with be very efficient with our time and then just go home, and then there'll kind of be the leeway to go home. Because at the beginning, no one's really, you're just kind of trying to find your footing. You're not really like focusing on the nitty gritty, like revising and all of this. Nah, I don't. Maybe some people, I don't know about them, but for me, I wasn't. So yeah.
I have to say, like, did you have like that introductory period as well, like getting into the hospital, like all that system? How long was that then?
I think majority hospitals probably have that because it's quite a big and new environment, especially if you never worked there before.
Exactly.
But for us, I think it was 4 weeks induction.
Okay.
Well, the first 2 weeks was like the official induction, so looking at the different wards and something. But we had cardiovascular, AMU, the acute medicine unit, which very rapid, very fast paced. Like every day is like a new. You don't really have long stay patients. It's new every day. Monday morning you're gonna come in and there's 20 drug histories to be done. Ooh. It's a lot, which I'll also get into in a moment. Yeah. Frailty, of course, looking after elderly people.
Did you do pediatrics?
Yeah, I had a 4-week.
That's interesting.
I had a 4-week rotation in pediatrics. There was medical information. There was respiratory, but I wasn't really there because it was mostly COVID patients. I was in maternity for like a day.
Was there a surgical ward?
Oh my god, that's a big one that I'm missing. That's it. Surgery as well. So in that induction period, we like went to all those wards, sort of looked around, seeing what we would be doing on the day to day, which is doing drugs, histories, and medicines reconciliation. Yeah, that's it. And basically, that is just asking the patients their entire history, what medications that they're on, drug allergies, any other food allergies, any like skin stuff like creams, patches, because a lot of patients don't actually think of those as medication, so you gotta ask. And then like stuff like patches, are they a smoker, like everything, like what is their entire medication history, and then you're sort of just comparing that to what they're on in hospital. Are they being given all their regular meds, especially if they're like a long stay patient? Do they have to come off something? Do they have to add something on? You have to optimize their therapy. Like, is there anything that's interacting? Do we have to increase the dose, reduce the dose? Like, all these things, like, there's so many things that you have to, like, consider and sort of do. And then doing the discharge as well. That's a big thing.
So that was, like, med rec and med optimization as well.
Yeah.
And then you had to do, like, for the discharge, you had to do TTOs as well, isn't it?
Yeah, that's it. Yeah. Well, she remembers more than me. I don't know. Listen, it's gone out of my mind. But yeah, I mean, obviously, I'm not the one. Well, you do medicines histories by yourself because that's something that techs can do. But like all the reconciliation, optimization, TTOs, all those sort of things, like the pharmacist will be the one in charge of doing that. But obviously, as being in the hospital, you're gonna like be under the wing of the pharmacist, and you're probably gonna be helping them. You might even do some under the guidance of the pharmacist, but you're not gonna be the one to sign off like a TTO, because that is the pharmacist's job at the end of the day. And then later on, you see the other end in dispensary, so the TTOs will come down, which is all the discharge medication, and then you have to obviously dispense it. And in the hospital, the dispensary is a lot bigger. Like, you have a lot more of a variety of drugs, I would say, like so many injections. You see like a whole basement or warehouse. We even had a rotation with the people dealing with all the warehouse medicines. But it's interesting, you have to deal with like the procurement, I think it's called, of the drugs, like dealing with the suppliers, chasing up deliveries, seeing what's in stock, what's out of stock, can we get this medicine? if we don't have it at that hospital, can we get it from the other affiliate hospital? If they don't have it, can we get it at one of the other King's Trusts? Like, it's a whole process. But yeah, in essence, the induction was just getting to know all the different wards and what I'm going to be doing, which I just explained. And then after that, yeah, so the mornings was the split up ward, and then dispensary in the afternoon, or like project, or many of the other rotations that I had was mental health, where I went to, I think I had a day or two at Oxley's. There was mental health medical information, which was actually really nice. Like, I would do that job. I would apply for that job now. It was quite interesting. Yeah, and then I went to a psychiatric intensive care unit. Yeah, it was just quite interesting to see like that aspect of pharmacy and that aspect of healthcare, and like how the pharmacist works to like optimize all their medicines, and especially with a lot of the mental health drugs, there's so many side effects. So you have to like learn the common things to prescribe to like combat that. There was a GP placement.
Oh,
there was,
yeah. Your tutor, did you have a tutor?
Oh yeah, oh my god, sorry, I forget. Yeah, so I had a tutor. I think she was the lead for Gen Med. That's another that I forgot. Gen Med, yeah, that's like general medicine basically. Anything's thrown in there. You have like diabetes and all the other like main medical disease areas is on the Gen Med. And yeah, she was a pharmacist for Gen Med, and she was really nice. She was actually really lovely, and she would help me, and she sent me like her revision material for pre-reg. Very organised. The lady is very, very organised and very lovely. So I have no complaints of her. But in general, in terms of the day-to-day, I would say it wasn't too bad. Like, sometimes it will be like really busy, and like there's like so many drug histories to do, and sometimes they'll be like, okay, forget your timetable, especially during the Christmas period. For those like 2-3 weeks, they were like, we're going off schedule, you're going to go to where you're needed, because obviously Christmas time is a very busy time in hospital, people are taking holidays, so you sort of just go where they will allocate you, and then we're just drug history machines and dispensers basically at that time. And yeah, but I guess in the end, at least I like that there was that flexibility on like when to go home and like studying, and you learn a lot on the wards. Like, you witness a lot of disease areas, and I feel like in hospital the pre-reg is what you make it, because you get more out of it when you're more engaged. You actually like do the learning. They'll be like, oh, look up that, and there'll also be the learning activities, you know, the case-based discussions and all these other things, and I would do those. And yeah,
so mine, community, I mean, where do I begin is the question. I think more differently to hers is that my one was more like a routine. It was your average 9 to 5 kind of workplace. It wasn't 9 to 5, it was 9 to 6.
Yeah.
But, you know. As a pre-reg in community, I'll speak about other places, because I know like branches like Boots, they have like a set thing that you do, but like independent, there's not really a structure to it. But in a way it is like, I was basically the glorified dispenser of the place. So we had counter staff, there was quite a few counter staff, and dispensary was quite small, so there was just me, the pharmacist, and somebody else doing the dossets. During when we did the whole pre-reg was obviously during COVID time, so my pharmacy was doing...
There was even a lockdown during our pre-reg.
Yeah.
Oh my god.
Yeah, there was. There was a lockdown for us.
No.
And my pharmacy was basically doing everything under the umbrella of like essential advanced enhanced services. We had like a vaccination clinic, which is very typical of a lot of community places now.
Yeah.
So we had like a whole clinic with hubs and stuff.
You guys were strong on the COVID stuff.
Yeah, for sure. So we were doing fit to flies, PCR tests, antigen tests, you name it. Travel vaccinations, flu, COVID. And then I think we basically became a travel agency. And the phone was in the dispensary, so it was all on me. So every day for me was just dispense, print prescriptions, process prescriptions, pick up the phone, speak to them. They'll always be asking, oh, I'm traveling here, how long, what test should I be taking, and how long before the flight. So I just give them a whole speech. We get so many deliveries as well, so putting away deliveries, stocking up shelves. I think with community as well, it's quite daunting in a way because you come fresh from university and then you kind of push
especially
into
if you
the
haven't
deep
had a
end.
job before.
Exactly. So my experience of community prior to that was like 1 year, only Saturday job, just being counter staff. So I had no dispensary experience apart from dispensing labs in uni. And the program that our place used was Proscript, which I think
Very typical
a lot of places use that, which is very good for me now.
Yeah, man, that's one thing I would say, because we had some random, I can't remember what it's called anymore, but I've only heard hospitals using it.
Oh, is it? Yeah,
So
I think they have their own secure thing, that's why. So yeah, I had to learn Proscript, and I remember the first Saturday that I worked there. Mind you, there's like 2 pharmacists. So one of them, he works there on the weekdays, and one, he's like the boss of the place. But he only works there on Saturdays. So he would prioritize the COVID vaccinations and stuff, and he would leave the dispensary to me. So in a way, I was the responsible pharmacist of the dispensary. and basically, the counter staff would also come to me. But I remember that first Saturday I had, and my God, I was literally pushed into the deep end, because the only other experience I had was like the 2 days before that I started, where they told me how to process prescriptions and stuff. So I had to extract stuff from my brain that I didn't know was there to dispense prescriptions, especially the ones that come in on the day, like the coloured ones, the green ones, the dentist.
Did they give you the SOPs?
Yes, they did. Oh my God, that was like my first 2 days there. Oh my God, there was like this massive folder for the entire of the first day. I read the SOPs, and then second day, like, because I was like bam, 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 I was like reading so vigorously. Like I only had a little bit left. So second day, I did that for the morning, and then I think I did dispensing for the rest. But also on the first day, I did a lot of the SOP reading, and then my tutor, he took me to the vaccination clinic, and I did my first kind of vaccination session. I did the whole interview pre-injection kind of thing, and then the filling of the syringe and the vial reconstitution, I did that, and I knew I'm never doing that again. So every day since then was just like dispensary, and it doesn't sound like a lot, but it is a lot. And I found it very hard to juggle the kind of revision side of pre-reg and the work side. Because like I said, I was exhausted, and I would be doing a bulk of the work. Like, it was crazy. And I had a lot of responsibility, and still I feel like they expected more from me. I said there was deliveries as well, right? So there was deliveries, and there was ordering those stuff as well. So checking stock, people also call to repeat prescription and stuff, and sometimes people come in for responding to symptoms. So I would do that as well. Not too much. I like to say though, like, I think because of that whole routine, I did become a bit too comfortable with my position as being a dispenser. Because I feel like it kind of set me up in a bad way, because now that I'm practicing as a pharmacist, I'm like, oh my God, I'm not that confident. Like, I was mostly hiding away in the dispensary. And I had an excuse to hide away because there was too much to be done in the dispensary. But I just feel like maybe if I tried more to interact with the patients, I'd be a lot more confident now. Not to say that I'm not, but I think sometimes I do forget stuff as well. And then after a consultation, I would be like, oh damn, I did forget.
I feel like I had the same and opposite experience. Because obviously while I was doing the medication histories, I'm always talking to the patient, I have to interact with them. I remember I called one guy's wife to, like, because sometimes you have to call other sources to verify the information they've given. And I would like call their wives to say, oh, your husband said hi. And also, yeah. Because they'll be like, okay, say that to my wife for me. I'll be like, I mean, sure.
Messages.
I was getting involved in some of these patients' lives. It's quite funny. So yeah, like, I guess I would sort of have that experience, and also me and the pharmacist will also go through like what the mechanism of these medicine and all the disease stuff. So like I'm thinking so clinically, but now that I'm working in community, I'm like, having that like, oh my God, wait, what? This, I'm not having to use any of that clinical knowledge that I've got.
Yeah, especially for community, I feel like, because I know that there's some people who bring out their BNF every day and go above and beyond and read about everything. And that was me for like the first 2 days and so. And then after that, I realized, nah, it's too busy. I can't have the leisure of learning on the side.
Yeah.
So like literally, it became more like muscle memory work for me. So everything was just second nature. And talking to patients was mostly on the phone. A lot of patients came in. I have my 1 or 2 patients that, you know, they remember my name.
Whoa.
I did build up a relationship with some few people here and there. So there was that.
And you have OTC as well, because I barely like, even now, I struggle with OTC.
Because I think that sometimes you would ask me a question and I would know the brand name and the
she literally knows it all. I'm like,
so I think I felt like I wasn't learning, but in a way I was learning.
You were.
But I feel like I wasn't paying enough attention to the actual prescriptions, as in like I could have learned more about dosage regimens, the kind of indications. I think I just glossed over things more like kind of legal clinical check. That's it.
That was good. I was literally focused on clinical. Barely did accuracy checking.
I feel like because I think I had that safety net of the pharmacist is gonna check it after me. I kind
you don't take it seriously.
I didn't take it seriously at all, and I think it was such a fast-paced environment that I felt like I'm behind all the time. So you know, as long as I do my job, he can do the rest.
Yeah, everyone has their role. That's the thing.
Yeah, so it was kind of like a bad mindset. But listen, when you have like 50 customers coming in and it's time for your lunch, and there's only 2 counter staff, and they come over and they're like, can you find this prescription? Can you find this prescription? And then you're just looking everywhere. Like, there's no time to spend time.
Yeah,
is what I'm saying.
But I feel like that's such a huge difference, because where I work is obviously, it's such a wide team, the wider pharmacy team.
Exactly.
Even within the pharmacy team, it's not just pharmacists, it's the techs, there's all the other people dealing with the ordering of the medicine, the suppliers, you have nurses, doctors, like so many people. So like, if the pharmacy team goes on a break from 1 to 2, like, it's not gonna you know, it's not a big impact, because you're gonna be back on the ward after lunch, and the nurses are there, the physios, everyone is there. It's more pressure off your back in that sense that you know, you can plan your day more out a bit. Like, whereas for you, it's just like you're doing so many things at once, which is obviously true for hospitals. They're very busy and like there's so many things to do. But like, if you want to take your lunch, then you take your lunch. You go. You're entitled to that 1 hour off. So.
And now that you mention it, like since becoming a pharmacist, I like literally found out that there was places that closed for lunch. I did not know that was a thing. I didn't know that existed. And so places that I've worked at now that have pre-regs, I'm thinking, you have the luxury of not like getting up during your lunch to help, which happened so often for me as well. People would come in during lunchtime. So it was kind of like a working lunch for me as well.
Where was it paid?
It was unpaid 1 hour lunch. You know, you sit down and somebody's asking for help, somebody's asking to dispense because the pharmacist will be off vaccinating or something.
Yeah,
so, and there's like a long queue of people and they're waiting. So, you know, like I go to help and this and that. So for my place, as I said, it was quite unstructured. Everything was on me. So it was on me to do my own studying, learning this and that. And then obviously you'd have your tutor meetings, like every once in a while. Like, I think it was like 8 weeks, 32 weeks, every 8 weeks, wasn't it? A tutor meeting, that was the compulsory tutor meetings that every pre-reg had to do. So other than that, it was self-learning. I know that one of my friends did her pre-reg in Boots. And Boots has a structure. They have their own kind of portfolio to be doing. So they have their designated study time. So their lunch times were quite long. I remember one of my friends saying it was like an hour or something. Like it was joint with her study time. And I think they kind of had like rotation as well. I had no such rotation going on. I know that a lot of places have like dispensary rotation, counter rotation. I was just in dispensary. So literally just matters based on each and every community pharmacy, what kind of experience you have. I think independents are more so you do everything yourself and there's no structure. Chain pharmacies, there's probably more of a program that you go by.
Tune in for part 2 where we're gonna spill more tea and just talk about the things to change and like advice and all the other bits and bobs. Cheers!